Now, with 35 new confirmed cases of the novel coronavirus, Nigeria now has a total of 442 confirmed cases. We'll find out how Nigeria's health authorities are working to build a resilient healthcare system to counter the COVID-19 pandemic. And Nigeria's Health Minister, Osagie Ehanire, joins me now from Abuja for this discussion. Thank you so much for joining me on the show today, Minister. Now, in looking at your strategies for containing the spread, at the task force meeting yesterday, you gave a warning to private hospitals treating COVID-19 patients without accreditation. How are you working to prevent this from happening?
Well, what we are doing is to increase the awareness creation among doctors who are underrating the very high level of infectiousness of this virus, and they're warning them to desist from putting themselves and their other patients at risk. The communication is going on directly by media and also through the organizations in Nigeria Medical Association and the Association of Private Medical Practitioners. There are rules and regulations for private sector to participate if they meet the criteria and must have an accreditation to treat such highly infectious diseases.
All right, now with 303 cases reported in April alone so far, how is Nigeria working to build its healthcare system? I understand you've been doing quite a lot of work, on getting labs accredited to test. I'd like to know the work that is going on.
Yes, we have about 13 public health laboratories now that are in a position to handle the diagnosis for coronavirus. This outbreak has helped us to realize the weaknesses and also the strengths in our health system, and giving us the opportunity to start reshaping that system, both in the public health sector and also in the routine health delivery. We have made a lot of improvement in procurement and plans and also processes to revamp the entire management system of the health sector. So it is an opportunity that is widely regarded and accepted and appreciated by both the public and the government to allow us to build a resilient and service patient-centered health system.
All right, now, but we've also seen a remarkable increase in the number of recoveries in Nigeria, and as the lockdown is extending now. How are you working to educate Nigerians to still continue on the safety practices that you started with since this pandemic came, and also how are you working to dispel the disinformation as well?
Yes, we have a briefing every day for Nigerians, Monday to Friday. Sometimes on Saturdays, we also use the media, television, and radio as opportunities to talk to the people, particularly to cancel the effect of rumors and fake news, as it's called nowadays, in the social media. So we give the correct news and the correct information officially every day at 2 p.m. And there we also update on new approaches and new strategies that government is adopting. But above all, we use it to educate the people, to try and calm nerves, to try and reduce the fears that are in the population, and also to get more compliance and more cooperation. I use it also to address traditional rulers and gatekeepers of communities, religious leaders, to also have a positive effect in the non-medical interventions like social distancing, and to reduce the normal community gatherings that are a risk to the health of the public during this period of the outbreak. So we're using all manners of messaging strategies to inform and educate the people.
All right, then on testing, though, I'd like to know how you're planning to ramp up testing, because we're seeing latest figures show that Nigeria has recorded just about 6,649 tests so far. Meanwhile, Ghana, on the other hand, is doing over 15,000 tests. I'd like to know how we're working to ramp up tests in Nigeria, and what are the targets you're looking at?
Yes, we are doing that right now. We, in fact, have embarked on a house-to-house campaign of sample collection, particularly in the hotspots, which are Lagos and Abuja. We have these areas where we have international airports, and these are the presumptive areas where the concentration of cases came from travelers who came into the country. So we are ramping up the testing and have also outsourced the sample collection to various private entities and laboratories and hospitals in various parts of the cities where suspect cases can now have their samples taken and tested centrally. So we intend to be able to increase the rate to quite drastically in the coming days. And we're also increasing laboratory assets as we go along.
All right, now, but looking at how the government is working to meet up with the shortfalls in the health value chain, especially with the manpower, skills, and equipment, I can imagine the huge burden on the healthcare system, on the health workers there. You know, what I'm trying to imagine what you're trying to do to boost the morale of people in the front line and how they're going and how you're trying to also get more people to come into the healthcare system to assist.
Yes, we are preparing the manpower that will not only help in the front side of trying to reduce the caseload, but also to work on the backside of treated patients, case management. So the particular incentive is a new health insurance and life insurance and hazard allowance that is given to healthcare workers. And we are also doing crash courses for critical care specialists, good doctors and nurses, and improving the supply of equipment, ventilators, and the quality of ICUs all over the country. Fortunately, we have not had to use much of these assets till now, but we follow the principle of striving for the best outcomes, but also preparing for the worst situation. So we are ramping up the readiness and preparedness of our care delivery centers and isolation centers, and doing everything to find cases and isolate them according to various levels of comforts, in fact, that the persons require.
All right, then, on looking at the level of international support you are receiving, I'd like to know, how international the community is coming to help out. I understand that we had some Chinese doctors coming in the country as well. I understand that there was some controversy around it, but I'd like to know how the ministry is working to assure Nigerians that the intentions of international partners are genuine.
Yes, we have had a lot of support, particularly from the multilaterals. The UN group provided us a good sum of money and also which was used to procure commodities which have entered our stock to increase our stockpile. We have also had technical advice from the United States. They have visited us here at my ministry and provided us with experts who help us in our planning. We are presently, in fact, doing a new action plan to respond to the phase of community transmission which we are going into, which requires a new strategy. And we have also received from China quite a lot of support, both from the private sector of the Jack Ma Group and also the Chinese government and various construction companies around here who have helped us with trying to get our supplies in good order. We are having a fairly reasonable stockpile right now.
All right, but I'd like to take you back on what you just said around, the new strategies for community testing, and I'd like to know how that is going to play out and what are the timelines we're looking at.
Well, before now, we were targeting travelers because this is an imported pathogen. So we just targeted the travelers who came in, tested them, monitored them, tested them, found the positive cases, and then traced their contacts. But now we're going into community transmission, where there are persons who do not necessarily fit any of the criteria, who have not traveled and who do not have any contacts of people who traveled, and who are now the first phase of those who are suspected of leading us into community transmission. We are engaging the gatekeepers of society, traditional rulers, and the primary healthcare system for case finding, to create demand, and have more people come out for testing and to bring taboos and stigma around the coronavirus so that we can have a greater acceptability and have the cooperation of the population in collecting samples, particularly in the hotspot areas.
All right, Honorable Minister, thank you so much for your time on the show today. Definitely, we wish you all the best as you go on to try and work to contain the spread of the COVID-19 pandemic in Nigeria. Thank you so much for your time. I've been speaking to Osagie Ehanire, he's Nigeria's health minister.